So I studied veterinary medicine in my hometown, Sassari. I'm from Sardinia originally, in Italy. And I was lucky enough that we had a veterinary school there. So I graduated there, and then a couple of years I stayed in small animal practice. I came to Ireland the first time in 2000 with a scholarship that didn't go quite well. It was the time of the big foot and mouth pandemic, so to speak. So the study that I was supposed to do about horses didn't actually happen because there was no movement of horses or any animal for basically the whole time that I was here. And I was always freezing cold, so when I left Ireland I said I'd never come back. And of course a year later there was an opening for the residency in diagnostic imaging, and I did come back for the interview, and I said, well, we'll see. And I got the residency, and that was 4 years of residency. At the end of that I got my European diploma as a specialist in veterinary diagnostic imaging. And after that, so that was in 2006. In 2007 I did the interview to become lecturer. At the time it was called, now it's assistant professor. And so then I started, a more proper teaching and clinical work here. And then, in the last few years I've done various things. I've been module coordinator of the musculoskeletal module. I've been stage coordinator of stage 4 for 5 amazing years. And then I've done a diploma in University Teaching and Learning from UCD here. And I also did the diploma from the Innovation Academy in Innovation and Creativity in Teaching. I got invited to other places, conferences. The most recent one was in Turkey a couple of years ago to present 2 talks. I have to say I've never been a particularly dedicated person to research. And I remember when I finished my residency at the interview for the job, they asked me, do you want to do a PhD? And I said, no, I've just finished studying for the diploma. Last thing I want to do is more studying. But then I've always said, as I was mentioning, that I would do a PhD if the right thing comes along and there is something that I'm passionate about. And my mixed reality system is something that I'm passionate about. So 3 years ago, I decided that was the way to go. Plus, I felt like, I've done my diplomas, my specialistic diploma as a radiologist. I felt like as an academic, a PhD is really what was missing from my career. So I decided to go down that road. I was going to work on them anyway and develop it and see if it can be used. A video that was recorded by my colleague, Dr. Huanghui Hu from the School of Computer Science, who's the person that I'm collaborating with to create my mixed reality system. And basically what we wanted to create is a system that would allow in the future students to practice obtaining radiographs of in this case of horses, without the use of radiation and without the use of clinical patients. So the system has a virtual horse, a virtual image detector, which is that structure there, and a virtual portable X-ray machine, which is basically a replica of the portable machine that we have here in the hospital. And the X-ray tube basically has almost all the little bits and pieces, so to speak, of a normal X-ray tube. This is what Assoc is doing, is moving the marker that we usually put on a cassette or image detector. And there is a little retractable exposure button. And then on the OS machine, what we can do is obtain a simulated radiograph of the area. So the system doesn't use radiation and doesn't use real animals, but it still is able to teach the student, well, we have to validate it obviously, but I've done a preliminary study with a panel of experts. I can say much more about that because I still have to publish it, so yeah. I suppose I can't say too much. It's mostly initially it's for teaching, is what I kind of envision it for. I suppose looking at the future and the potential applications, it could also be used by a vet to show an owner, for example, the problems that his animal has. So at the moment, again, we're using the horse, but he might be, or a model horse, but I suppose it could be adapted to small animals as well. In the School of Radiography, they have an X-ray suit where there is a virtual machine and there is a mannequin, and they take virtual radiographs. They are radiographers trained already with virtual reality or mixed reality. This is my PhD, is kind of further developing the system that we've created so far and see its potential application, see whether it can be used as a teaching tool that is efficient for the students. So because obviously it looks very nice and students are going to be very excited to try it. And from the point of view of safety. You're not exposing them to radiation, and you're not exposing them to the dangers of working around a large animal that is potentially dangerous. But at the same time, we have to actually validate the fact that students using it are actually able to learn what they are supposed, so the skill of taking radiographs, which we're hopefully that he will do, but it will have to be kind of a future study to actually, validate the value of the system as a teaching tool compared to what they do now. What I would love is for, at the end of the PhD, I would like to have the validation that the system works as a teaching tool. So do 1 or 2 studies where I actually show that students can actually learn the technique. And then obviously long-term, my dream would be to actually implement it in the curriculum. So actually use it in practice rather than just having this nice tool that it works, but it cannot be used. Yeah. The idea would be to do, it can't be a randomized trial, but I would get 2 groups of students, one that get taught the normal way and others that get taught with using the system, and then see if they're able to do the same task at the end of it. The basic will be pretty simple, but I need to validate that they can actually learn the motor skills. Okay. I've started working on this maybe 4 or 5 years ago. I was doing the diploma in teaching and learning in UCD, and a professor from the School of Radiography one day, as one of the assignments, presented what they were doing in the School of Radiography. And so I asked him if I could go and see it, because I said, well, maybe we can apply this for our animals as well. And it started I was trying to do it for small animals. So it's probably more than 5 years ago. I would say it's probably 6 or 7. So I was in contact with somebody, with the same engineer that created the system for them from New Zealand. But that project could not go ahead for a variety of reasons, mostly lack of funding. And then I won a competition that was publicized by Edify. It's a company that creates virtual realities and system for teaching. And my project was one of the 10 out of 150, I think, know the word that was picked out. Yeah, that was virtual reality. And then one day I was presented, but I never got to actually use it for teaching because, again, it lost momentum after a while. It was a little bit difficult to the connections with the computer and everything. And then one day I was presenting that in the School of Computer Science for a day on applications of VR and MR, and I met Dr. Hu. He was doing his PhD and he told me, maybe I could help you to develop this. And he was already collaborating with Dr. Aaron Kumar from Anatomy and David Kilroy, Dr. Kilroy. We just started working together. I told him what I wanted, and within 6 weeks he had created the basic stuff. He's a pretty amazing guy. He's very clever, because every time I would ask him, look, could we add this and could we add that? And he was able to implement it. It's a very nice system. He does pretty nicely what he's supposed to be doing. We did a couple of initial studies for his side of things that he presented at his own conferences on computer science, and they were more about the coding and the movement around the horse. It is quite cool and it looks like a game, but it allows you to practice in complete safety. Yesterday I was doing a practical with the locomotion module for, I think it's stage 2 grad entry, and it's all about this, showing the students how to the main position to obtain, the main views, the main radiographic views, to take radiographs of the legs of horses, and the safety around it, the radiation safety around it, and all the technical things. And what I've showed them in 3 hours with a skeleton horse, I would probably have done much quicker with this and more efficiently, because they could actually get to see what they're doing. It's basically used in many other applications. Simulation is simulation-based education or training are very diffuse in the healthcare and even veterinary world. It's just there's nothing yet in radiography, so that would be my little niche. Of course, I see it as my baby, and we're currently working on improving the mobility of the horse so that it looks a little bit more real, and so that will be the next step.